really nice to meet you.
Nice to meet you, Anna.
Can you tell me your name?
I'm Dr. Gulden Bal. I'm a general surgeon and obesity and metabolic surgery specialist. I am working in our special clinic in İzmir, Alsancak.
Yeah, I just had a tour around your clinic. It looks very good.
I hope you like it.
Yeah, the atmosphere is very good.
Thank you so much. Our team working for obesity therapies, especially gastric botox, gastric intragastric balloon, and obesity surgery, of course. We work with in Turkish patients.
You work inside Turkey?
Yeah, also international area for this.
Yeah, it's very good.
Yeah.
Also, you can speak English. You know, this is very
Yeah, thank you so much.
Turkey. Yeah.
I am educated in Ankara Hacettepe University. After Faculty of Medicine, I work in general surgery department for 6 years. After that, in 2013, I came to İzmir back because I was born here. My family is here for since 1960s. I love İzmir.
It's a beautiful city.
Yeah,
I agree with you.
And of course, İzmir is suitable for health tourism for a long years. Because
but I know a lot of people, they go to Istanbul for this purposes.
Obesity surgery, of course, and gastric balloon and gastric botox in İzmir, we work lots of countries and lots of patients here. There are lots of teams, different clinics, different hospitals, of course.
Okay, are the prices here in İzmir lower than in Istanbul?
Than Istanbul, yes.
Yeah?
Yes. It's lower than.
Why so? Actually, it's the same procedure.
I think the numbers of patients
Matters.
Yeah, that's why.
I agree.
But we always use guaranteed medical materials, device, and A+ quality hospitals. This is our differences.
So surgery itself, it doesn't happen here?
No, it doesn't happen here. We contact some hospitals in İzmir, especially A+ hospitals and university hospitals. We do outpatient works there and also bariatric surgery in general anesthesia. We use their emergency and their operation rooms. Also in İzmir we work with quality hotels. There are lots of accommodations, chairs here.
A patient can choose the hospital and also the hotel.
Of course, of course.
That's good.
We are lots of packages for this.
Okay, so you're dealing with obesity. What's the most difficult procedure? Which one is the most difficult for a doctor?
For a doctor or for a patient?
For a doctor and for a patient is also important actually.
Yeah, all of the procedures has many little or lots risks. So if a patient needs an operating procedure, of course it's difficult than the others for patients. But if team and doctors, nurses and coordinations team and dietitians is work for this area for long years, I think there isn't any difficult procedure for us.
You know, I researched a bit on the internet before coming here. I know there are a few types of reducting stomach. You know, like, I forgot. What are they?
Clean gastric?
Yeah.
Gastric bypass procedures. There are lots of treatment procedure for obese patients.
How do you choose one?
Of course, it's important for these to work for patients. is eligible procedure. For example, one patient in same kilos, for example, same kilos and same heights, two patients, same age, same gender, same diseases. One needs a sleeve gastrectomy, one needs a gastric bypass. It
How do
depends.
you know this?
It depends. Patient daily life changes, work ability, and eating habits, psychosocial status. It depends on the patient. So there isn't one method for this. For example, our patient, we contact with the patient. We how I can say, we talk about all these factorial effects of this. So and lots of the way we choose a program for a patient. So it depends on the patient's multifactorial things.
Yeah, I understand. Are all these procedures same way effective? Or some of them are less effective and others?
These procedures has different type to weight loss procedure. For example, sleeve gastrectomy, we cut the stomach nearly 80%.
Yeah, I saw pictures.
Yeah.
It's very fine.
So the new stomach is like a tube. So patient can't eat so much. Of course, in the other hand, it has a hormonal metabolism. So eating behaviorally and physically reduce. In the other hand, bypass procedures, lots of types of the bypass, gastric bypass, mini gastric bypass, hernia gastric bypass, etc. These mechanism, yes, it reduce the eating portion, and of course, if the patient eat more than their capacity,
what happens?
The bypass procedures eliminate the food intakes, so don't absorb.
So the food doesn't absorb at all?
Yeah.
So even if the patient eats a lot, it causes no harm?
Yeah, of course.
Really?
But our aim isn't eating
a lot.
eating a lot, of course. So the key point in obesity procedures is physically and behavior change. So eating quality, eating ingredients, eating portions, it must change. If it isn't changed, at the end of these procedures have lost their effects.
Really?
Yeah.
So the stomach gets bigger again?
In sleeve gastrectomy, maybe 55% of patients.
But it's really hard. For example, if I get used to eat hamburgers all the time, and now I have to keep all the salads on my table, it's really hard for the patient.
Yeah, it's behavioral change. Our team work on it. Our dietitian coordination, we help this, and psychiatry maybe.
Okay, if someone comes from abroad, how can you help this person? For a long time after surgery also.
And abroad patients, we have a program online. So after the procedure, especially in operative procedures, we work for the patient for 2 years.
Oh,
yeah.
Wow. So you
So
it's controlling.
It's success rate is induced so that way.
What about tests before the procedure? How many tests do I need? For example, if I wanted to do this.
We have lots of tests for this, and there are lots of biochemical tests for this, and hormonal tests, and endoscopy, ultrasonography, echocardiography, and our patients, they have physical examinations for cardiologists, pulmonologists, and psychiatrists also, and internal medicine, and of course anesthesia. So we choose the right procedures and right patient. If he needs some medication or some time for the procedures, we do this. We never want to harm a patient,
Of course.
and we never want an early operation for this. So if the time is in right time and right procedure, it means a success for the patient, and of course me.
Yeah, I understand it's your reputation.
Yeah.
So, if someone lives abroad and wants to come to Turkey for this procedure, how much time will it take? All the tests, or maybe this person can do all the tests where he or she lives?
No, we no need for this. These tests and these medical advices for I think 24 hours or 1 day.
Ah, really? So it's
If
really
everything
fast.
is all right, after the day we can do the procedure.
And how long does the healing last?
We need 3 days in the hospital, also with the pre-medication for this. After the procedures, our patients stay at hotels for 3 more days.
So it's 6 days.
Yeah,
Like
7 days.
1
7
week.
days, yeah. 1 month, 1 week.
And 2 years of coordination.
Yeah,
and
coordination, yeah.
Yeah. So you perform the surgery yourself?
Yeah, of course. With my nurse. He is a metabolic surgery nurse. But our team has 6 people for these procedures, and so we have all these things
All
in
specialties.
high quality. Yeah.
Okay, I know you prepared something.
Yeah.
For today. Do you want to tell this?
Yeah, of course. I really want to tell obesity a chronic disease. It's not an aesthetic problem. So it's a disease. If it is a disease, it must be treated. So
how do you know this is a disease or not? Or maybe it's just psychological something?
It depends. There are lots of reasons for obesity. Eating disorders, sleeping disorders, wrong disorder behavior, also genetic factors. Also, lots of disease may be responsible for obesity. These are test procedures is for this.
To find out the
Yeah,
reason.
to find out what the reason is. If reason is if solved for medication or dietitian support and exercises, we don't do anything. So, but if it is in some range for this, I mean, we introduce obesity for mathematical numbers. I mean body mass index.
Yeah,
it's universal mathematical value for us. So upper 30 we need to do something for this because we know at this point exercise and diet program isn't enough for to solve the problem. The problem is bigger than I
Can we
think.
measure my this
Of course.
index?
Of course we
Oh,
can. Our dietitian has a bioimpedance mechanism for this. We can,
Oh, I'm so curious.
yeah,
I've never done it in
we
my
can,
life.
we can do it.
Oh, I'm so curious. Thank you. Okay.
So if the number is high, what I told, we do some procedures for this. Our procedures start with gastric botox and bariatric surgery. These are big range for this.
So Botox is the easiest as a
Yeah, the easiest method for this. It's eligible for 15 kilos weight loss, for weight loss. Yeah.
So you can lose 50 kilos after this?
Yeah, 15.
15?
15,
Not
of
50.
course, not 50. 15 kilos in 6 months.
Wow, that's good.
If the weight is higher than excess body weight, of course, excess body weight is bigger than 15 kilos, we can do gastric balloon. Gastric balloon is a material is put on the stomach inside, and endoscopically it's not an operation. So
I see.
Yeah.
So it just takes some place inside.
some place in
So you
the
don't
stomach.
eat that much.
Yeah, patient can't
You're never hungry.
eat so much. Yeah. If the number is excess body weight is bigger than these numbers, bariatric procedures should be done.
Yeah, you recommend surgery then.
Yeah, because it's not so easy to lose 50, 60, maybe 100 kilos for these methods. In this situation, the operation shouldn't be late.
Oh, I understand. Okay. Do you have something else here on your papers to tell us?
I think we told everything we planned. I want to say to patients or people who are curious about this, we can't change the world, new world, but if we name the problem, we can process for them. So
we can solve it.
Yeah, we can solve it. So if we contact with us, we can solve this problem together.
Yeah. Thank you very much.
Thank you so much,
It was nice
Anna.
to meet you.
Welcome, Arkanik, again.
Thank you.